big campaign issues is the cornerstone, and it's very near and dear to my heart. I have a veteran father. I have a veteran uncle, both from the Vietnam War. I have a veteran friend, one of my best friends, who's under full disability with PTSD from Afghanistan. And watching him struggle through his daily life with debilitations that he suffers from, not being able to work his way into the normal employment sectors of society because of trigger issues. He doesn't have any substance abuse issues, but some members of our military suffering from PTSD have resorted to self-medication, and that's led to destruction of family lives, personal relationships. It's made it difficult for them to maintain employment or to find employment. There's a lot of negative side effects with PTSD, and in my opinion, after listening to what he had to say about all the therapies he's went through the VA, all the pharmaceutical medications that they put him on, the side effects that they've generated, and then they had to have more pharmaceutical medications to deal with those side effects, antidepressants, just a lot of medications to treat medication issues that they've caused. I did a lot of research on my own over the past 4 years, and after listening to a podcast, I was made aware that people were starting to really perform some studies and investigate the use of psychedelics to basically relax the mind so that the patient can actually recognize and analyze the underlying issues that's causing them to self-medicate, that's causing them not to be able to fit into a normal societal role or a normal family role. And when you combine all those, substance abuse, family, employment, then you start getting into possible suicidal tendencies. And we have a big problem with that in the veteran community. On average, the statistic is 22 veteran suicides per day. And having veterans in my family, having been in the military myself, I find that extremely unacceptable when I see research studies purporting successful treatment of the core issues, and these gentlemen and women not having to self-medicate, patching up their family relationships, gaining successful employment, and being a successful part of society. I see nothing but benefits. Now, it's not a magic bullet. It doesn't work for everybody or for everybody. And so these are some of the things I want to discuss. One of the organizations that was actually started by a former Green Beret is a big advocate. He actually had to travel outside of the U.S. to Mexico to receive this treatment. And it changed his life. And he is now the head of a huge organization with many members and many successful examples of success under these treatments. So I want to bring up a video where they kind of just briefly introduce that organization and what they do for veterans. He's actually pushed this through, along with other veterans and state legislators, through the Texas State House and State Senate, and the governor signed off. And they basically authorized Texas to conduct clinical studies and clinical application with veterans suffering from PTSD using psychedelics such as MDMA, psilocybin, ketamine, ibogaine. Ibogaine was and DMT therapy was one that Dakota Myers, he's a Medal of Honor winner, and he actually had to travel outside the country to receive this treatment. His life was upside down, and now he is right side up. And